So today I want to tell you guys a little bit about what pelvic health physical therapy involves. Most people have not heard of it, and if you have heard of it, you might not know exactly what to expect. So if you find a pelvic health physical therapist, you want to make sure that they've actually been to pelvic health courses so that they are well versed in pelvic anatomy, they know how to do internal exams, and they've actually been educated via a continuing education course or more on treating pelvic health patients. So that's kind of step one. And if you need help finding one in your area, I can help you out. There's a couple of websites that you can go to find clinicians in your area that are practicing pelvic health. We are first and foremost orthopedic physical therapists, so we treat head to toe, but we do focus on conditions of the pelvis like incontinence, pelvic pain, constipation, prolapse, pregnancy, postpartum, post-prostatectomy, all of those issues that are typically coming from the pelvis. That's what we specialize in treating. That does not mean that all we do is internal exams. And in fact, we don't spend an entire treatment in someone's vagina or rectum. We are treating head to toe. We're treating the big picture because the pelvis is not an island. It is connected to everything above and everything below it. So you want to find a therapist who's looking at the big picture. Sorry, my phone is gonna die. Okay. Who's looking at the big picture. When you come into pelvic health physical therapy, you are going to have a long conversation with your therapist. There's a lot more subjective history that we need to take for pelvic therapy. So very often you will spend the majority of your first session talking, answering questions, asking questions, getting to know your therapist, and really building a sense of trust with your therapist, because this is an intimate thing that we do. So we want you to feel very comfortable and confident in our skills and in the relationship that you feel like we have. We will do an external exam, so watching you move, watching you bend, testing your muscle strength, testing your sensation, just like you would do at any other physical therapy clinic if you were going for back pain or knee pain. If it's warranted, then we will talk about doing an internal exam, and that involves just our fingers. We don't use stirrups. It's you're covered with a sheet. You're not covered with paper, like a paper square. And a good pelvic health therapist is going to talk you through everything before he or she does anything to your body, and always ask permission. So you are in charge. It's your body. I always let my patients know where my hands are going to be, and I ask permission before I do anything, to the point that sometimes my patients get annoyed with me for constantly asking permission. But it's your body, and this is very intimate and can make, it can be very vulnerable, and my goal is always to put the control into your hands so you feel safe and comfortable. And that's just a small part of it, though. That internal exam gives us a lot of information, but very often then we're going to move on and we're going to address other things. So it is not an hour of vagina therapy. Yes, there are some times that treatment internally is warranted if you have pain, or if we're trying to get the muscles to work better and you need a little extra help, but that's not all it is. And we do a lot of exercise and movement and breathing, and I use a ton of manual therapy, really head to toe, working on mobility of the back and hips, and even down to the ankles. So it's really fun to kind of understand how your body is connected and to look at that big picture and get better, get this incontinence better, help your prolapse feel better, give you a pain-free pregnancy by focusing on the entire body. So that's pelvic therapy in a nutshell. we have a table. I have a curtain that I pull just to make you feel a little more secure, but you want to make sure that you find a therapist that makes you feel comfortable and confident, and who has actual pelvic health training, which involves either a fellowship or a residency or continuing education classes on pelvic health physical therapy. And again, if you need any help finding one in your area, please send me a message and let me know. I'm happy to help. And if you're in the Fayetteville area, I would love to see you in the clinic. But certainly if you have any questions, feel free to let me know, even if you don't necessarily need me right away. That's what I'm here for. So I hope that answers some of your questions about what exactly pelvic health physical therapy is and what to expect in a pelvic session.